to show you some minimally invasive procedure we used to correct a pretty extensive surgery a patient had, open surgery, and had a lot of hardware put in her foot. She was very unhappy with this, so we approached the correction by using minimally invasive procedures. You can see her result was pretty poor. She would walk on the third toe, second toe was out of line, so these were very painful toes for her. This is the x-ray. You can see they put a lot of fixation in her foot. So it was the second and third toe most painful for her. So we made a small percutaneous incision on the medial aspect of the second toe, and behind or out of the way of the fixation, we basically made an osteotomy and leaving the fixation inside. We did this with a burr, and this allowed us to move this toe away and more right disposition. So this is how it looked after we did the osteotomy there. Did the same thing to the third toe as well, osteotomy on the lateral side, and we were able to push these toes back into a more erect disposition. This is the osteotomy we performed in the fourth proximal phalanx. So already getting a lot better correction here. You can see when I put pressure on the foot, it's straightening out pretty good. So this is you see my osteotomies and behind our fixation there. This is post-op 6 weeks, a lot better looking. Patient's not having any pain now. This is a fixation in, and where we worked around the fixation. She's having no problems, no pain with her foot. So this is pre-op. You can see she's walking on top of her toe. So this extensive surgery I had was not very good for her. And this is what we got post-op 6 weeks, and a procedure that took us literally 10 minutes to do, or even less. And we're able to get her back to normal activity.